Welcome to the Dr. Azer Links Clinic, specializing in women's health. You can reach us at 78045-40351. We are the home of EndoSure. I'm Dr. Sam Azer, gynecologist at Links Clinic. This video provides information about endometriosis, where tissue grows outside the uterus. There is no conflict of interest. Endometriosis is more than just period pain that all women have. It is a whole body disease. The endometriosis patient journey often involves delayed diagnosis, averaging 5 to 12 years. This delay occurs despite 90% of patients experiencing pelvic pain. Endometriosis impacts various life domains. It affects daily function with chronic pain and fatigue. It also impacts education, career, and finances. Painful periods, or adolescent dysmenorrhea, have a ripple effect on the entire family. It leads to missed school and life for the teen and shifted resources for parents and siblings. Severe menstrual pain and endometriosis can lead to frequent school absences and declining academic performance, causing fear for future goals. This impacts mental health with frustration, depression, and anxiety. Patients often experience self-doubt and internalized stigma, inhibited help-seeking, and repeated disbelief. External barriers include medical normalization and dismissal of symptoms by school nurses due to lack of training. There is a gap in knowledge between social support and recognition for visible conditions, and the disbelief and isolation experienced with the invisible suffering of endometriosis. A patient might feel different and carry a burden of shame, which can lead to isolation and silence. This highlights the importance of open communication and support. Endometriosis triggers a cascading process, affecting both educational and professional trajectories. This can lead to absenteeism, academic difficulties, reduced income, and workplace discrimination. Infertility-related distress is a shared emotional burden for couples. Women experience a 5-fold increase in distress, and both men and women show increased anxiety related to fertility distress. Sampson's theory of retrograde menstruation describes the process. Step 1 is retrograde flow, followed by spillage. Step 3 is adhesion, and Step 4 is proliferation, forming ectopic lesion. Genetic factors play a role in the development of endometriosis, indicating a potential hereditary link. Endometriosis lesions can evolve from early-stage superficial lesions to deeper implants and the formation of endometriomas, affecting the reproductive organs. This slide details age-related patterns in endometriosis symptoms and progression. High dysmenorrhea is more prevalent in young adults, while asymptomatic presentations increase with age. Clinical phenotypes and symptoms vary by age group. Dysmenorrhea prevalence decreases as asymptomatic presentations increase with age, especially after 25 years. The graph shows a significant increase in surgical complexity with age, with a higher adjusted odds ratio for patients over 45 years. The adjusted odds for advanced disease are relatively stable across age groups from 25 to over 45 years, suggesting a plateau effect in advanced stage disease. Endometriosis symptoms include physical pain, fatigue, and sexual dysfunction. The condition also affects quality of life, which is comparable to other chronic diseases. Endometriosis lesions can be superficial, peritoneal, or deeply infiltrating. Deeply infiltrating endometriosis, known as DI, can affect multiple organs. The prevalence of severe dysmenorrhea is high in adolescents. Delayed diagnosis often means missing the therapeutic window for early intervention. The standard of care for endometriosis is diagnostic laparoscopy and surgical excision. Medical management can relieve pain, but does not remove the disease. Excision is critical for deeply infiltrating endometriosis, as it can restore organ function. Successful surgery requires experienced surgeons. The AAGL classification system helps in staging endometriosis. Stage 1 is minimal, while Stage 4 is severe, involving deep infiltration and ovarian endometriomas. Excision surgery provides a long-term solution for symptomatic relief, improved fertility, and reduced recurrence. It requires meticulous technique and anatomical knowledge. Complete surgical excision is a critical step in managing endometriosis, aiming to remove all visible lesions and adhesions to improve symptoms and fertility. This video shows a laparoscopic surgery setup for endometriosis. Excision surgery involves identifying and carefully removing lesions while preserving the healthy tissue. Surgical steps include adhesiolysis, identification of lesions, careful excision, and repair of affected organs. This procedure requires precision to prevent damage. For deeply infiltrating endometriosis, surgery can involve removing lesions from the bowel, bladder, or ureters, which requires advanced surgical skills. EndoSure is a comprehensive surgical program that addresses endometriosis in adolescents and young women. It utilizes a multidisciplinary approach. The program emphasizes early diagnosis and complete excision of endometriosis. It aims to prevent disease progression and improve long-term outcomes for patients. Early diagnosis is key, particularly in adolescents with severe dysmenorrhea. We use imaging and clinical evaluation to identify potential endometriosis. The program includes specialized gynecological care and psychological support for adolescents and their families to address the emotional toll of the disease. This approach aims to minimize the impact of endometriosis on school, career, and future fertility. Long-term follow-up is also a critical component of the program. The benefits of the EndoSure program include early, accurate diagnosis, complete surgical excision, and personalized postoperative care. This leads to significant improvement in pain symptoms, quality of life, and reduced recurrence rates compared to ablation or medical management alone. We are dedicated to educating adolescents, parents, and healthcare providers about the signs of endometriosis to reduce diagnostic delay. EndoSure provides hope by offering definitive treatment and comprehensive support to those suffering from endometriosis. Early intervention makes a difference. The goal is to restore normal life and empower adolescents to pursue their educational and career aspirations without the burden of chronic pain. Links Clinic is committed to advancing the care of women and adolescents with endometriosis through research, education, and compassionate clinical practice. Thank you for watching this video. For more information about the EndoSure program or to book a consultation, please contact Links Clinic. Contact Dr. Azer and the Links Clinic team for specialized care in women's health. 119-10111, Avenue NW Unit 104, Edmonton, ABT5G2X9. Our phone number is 7804540351. This video was proudly supported by the Links Clinic, home of the EndoSure program.